and snatching kids, right? That's essentially what people think that we do. And there's so much more to what we do. And so I wanted to provide the space for us to be able to have varying social workers with lived experiences from various areas of practice of social work to come and join us. And today we have Dr. Sade Mulkey. She is joining us from Michigan. I will give her the floor and she will introduce herself, give us her background, and she will be speaking on public health and social work and some work that she has done, as well as she has given us a really good resource that I'm excited for you all to see. It's really going to help in terms of really helping you transition or get into the public health side of social work. Dr. Mulkey?
All right. Hi, everyone. Let me share my screen. Okay, hopefully you all can see it. So I'm Sade Mulkey. I'm currently the Director of Strategic Initiatives at the University of Michigan School of Public Health in our Office of Public Health Practice. I'm going to have a lot of quotes throughout because I really like quotes. And I think this one, I tried to think of one that encompasses like me and my journey at this point. And it's the idea of like never being afraid to try. The only angle through which you can approach success is by the triangle. And a lot of people get into public health, I think, in a lot of trial and error. A lot of times, I'll talk a little bit about how I got into public health. So to get started, I thought it would be helpful to have some shared definitions because I know, especially with my family, they still don't fully understand what I do. And a lot of people don't necessarily understand what public health is. So I wanted to have some definitions so that we could all be on the same page. So public health really is about promoting and protecting the health of all people in their communities. It's science-backed and evidence-based field. And some of the things that can be done in public health are things like, of course, immunizations, which people think about. So like tracking disease outbreaks, setting safety standards for workers, advocating for laws and policies. So like thinking of smoke-free indoor air spaces and seatbelts, and even declaring racism as a public health crisis. And then when we think of public health, we also think a lot about the social determinants of health. And these are really the non-medical things that are impacting or influencing our health outcomes. So thinking of where we were born, where we work, grow, live, and play. And something that stood out to me that I heard once at a conference was that our zip code is a greater determinant of our health than anything, right? So the areas that you're born into have such big impacts on your health outcomes. So things that are other social determinants of health are like your education, unemployment and job insecurity, early childhood education, income levels. And of course, health equity, which is something we talk a lot about in public health, is the state in which everyone has a fair and just opportunity to attain their highest level of health. Also on this slide, I included some images from the Association of Schools and Programs in Public Health. They have a This is Public Health campaign. And I really like these images because it really shows the breadth of public health. With my students, I say like public health is everything and anything that you can think of, you can tie it back to public health. So on here, you can see things like voting is public health, health longevity is public health, peace is public health, global health is public health, for instance. So really any of the things that you're interested in can be tied to public health, which is why I really enjoy it. So about me, how did I get here? What do I do? So my educational journey, I always like to tell people I was born in Trinidad and Tobago. So I was born in a Caribbean island. If you know where Venezuela is, it's right above that. So it's the lowest island in the chain of Caribbean islands. And then I came to the US for graduate school. Well, undergraduate school, then graduate school. My undergraduate journey started at University of Rochester. I thought at the time when I went in as an undergraduate that I was going to be a diplomat. I was going to work in the UN, be an ambassador. And then I realized, like, I was interested in policy, but not that much. And I was like, okay, well, what are things I could be interested in or potentially do? The cool thing at the time about Rochester was you could create your own major. You didn't really have required classes, so you could kind of dabble in a little bit of everything. So I must admit, my first year of college was, a cluster of random things. Like I did American Sign Language, philosophy, brain and cognitive sciences. I was really just trying things out to see what I might potentially want to do. And I remember I was working at the IT center at the time and talking about my interests with one of my coworkers, and she's like, "Oh, what about the public health major?" And I was like, "Public health major? What's that?" It's, and then I started looking into it, and I was like, "Huh, this could be my jam." Now, ultimately, I of course went on and got the public health degree, and at the time also digital media studies, with a focus on graphics because I really enjoy graphic work. And that led to me going, and I'll talk a little bit about that in terms of my milestones a little bit later. But after that, I went on to University of Michigan, where I got both an MPH and MSW. So I got my Master's of Public Health in Health Behavior and Health Education, and a Master of Social Work in Management of Human Services. And there's also the option to get the certificate through the Network for Social Work Management on Human Services Management as part of our coursework. Um, I knew I was actually coming to Michigan for my MPH, but the MSW actually came a little bit later. Literally, I applied like a day or two before the last deadline that they had, because I had the public health undergraduate background. I was like, feel like I should do something else or something to complement the MPH. And at the time, I met a social worker. That's why I said the best angle is like trying things because you never know who's going to be put in your path. I was doing an internship at the Alliance for Coney Island in Brooklyn, and she happened to sit with me to have lunch and was talking to me. She happened to be a social worker who went to Michigan and was talking about how her biggest regret was not doing the dual MPH MSW program. And she was like 20 some years into her social work career at that time. So that really put the fire in me of like, okay, I'm going back and forth about this. Why not try, submit the application, see what happens? I have an interest in this. I've been looking at the program for a couple months now. Let's just submit the application. So I moved to Michigan and I literally moved into my apartment. I found out I got into the program registering for classes before I actually got my acceptance letter. So that was an interesting experience because I didn't know what the outcome was. Fast forward to now, last May, I completed my doctorate in social work. And a lot of times people ask, well, why DSW, or what was, the choice between that? And I did look at both doctorates in public health and doctorates in social work. And ultimately I decided to go with a doctorate of social work over the DRPH because I felt like social work was a little bit more of where I was leaning. It's like I had this public health background understanding, but I felt like social work, I was really tapping in and using my social work skills in the work that I was doing. So for my capstone for that, I actually did an evaluation of a community partnership that I oversee, which is in Grenada, another Caribbean island. And I did that at the University of Louisville. So that's a picture of me getting hooded last May. Very happy time to make it to the end of that program. And I'm like, okay, after the doctorate, I think I'm pretty good and done with school for now. So there are some key milestones that I want to talk about. And I really tried to think of what were those things along the journey that really helped propel my public health pathway. So the first thing on here is the Future Public Health Leaders Program. It's a CDC funded program that I actually now oversee. So I participated in this program myself back in 2013, and now I'm the program director. And this was the program, because of this program is why I declared myself as a public health major. So this program helped me explore what exactly public health was, what it meant, and there are all these different pathways or opportunities within there. The next thing on here, I don't know if you all have seen this before, but they are these little stuffed plushies. There's STIs, so sexually transmitted infections. There's like gonorrhea, syphilis, chlamydia up here. And I had that on there because a part of my public health journey was also this interest in like sexual and reproductive health. So after the program with FLIP, I went on to work at University Health Services on campus as a peer health educator. And we would do this event called Sex and Chocolate annually, where we, of course, have lots of chocolate, but talk to students about their sexual and reproductive health. And that really started me on the path of thinking around like health education and having uncomfortable conversations and getting people to be comfortable having these conversations. That led to this floral looking thing, which is the model of well-being here at Michigan. So once I came to Michigan, I continued the work as a program assistant at our what we call Wolverine Wellness, which is our student health services center. And there I was able to sort of expand beyond just sexual health. So thinking about sleep, thinking about mental health, thinking about consent, thinking about drinking, alcohol, and other drugs, and really do a variety of things as well as support students in that work. By the time I was doing that, I was also volunteering with what we have, which is this logo here, a Public Health Action Support Team, or FAST. And I think FAST was really a big catalyst into what I do now. So FAST is a student organization for graduate students that go out into the community to do public health. So we go out in a variety of ways. It could be things from helping at a food pantry to, at the time when I was a student, with the Flint water crisis, we were distributing water in Flint. We were also doing some community cleanups. I had the opportunity to go to the U.S. Virgin Islands after the hurricanes. I believe it was Hurricane Maria in 2017. And we were able to go and do what's called a CASPR, which is a CDC framework for community assessment for public health emergency response. Basically, they give you a survey, they tell you where to go, and it might be saying like go to every fifth house or whatever, and you follow that to collect data that they then aggregate together and can make some recommendations for how to respond to the emergency. From that, I also want to talk about the social work side. So while I was doing these things in the public health space, I was also getting my MSW, which is represented by this girl here, which is an organization called Girls Group. And Girls Group really, they do after school programming for middle school and high school students in Washtenaw County in Ann Arbor, where I am. And with that program, I was able to kind of see how I can bring public health into the social work space, but how they intersect and overlap. So when you think of group programming for students, right? In public health, you do educational programming. So you do groups and workshops. In social work, we do that and we think of like, oh, therapy groups or small groups, but it's really, to me, they're one and the same with how we were presenting the information. It's just a matter of the training and the skills that you have to do it. So I did that and I was able to work with them even up until after I graduated for a year on an initiative I started around parent engagement. So we noticed that parents weren't really being engaged with the program. And I was curious as to why. So I started a parent advisory council as a part of that. I do have the American flag on here because I think it's interesting. At the time when I was doing my MPH and MSW, I was also going through the first Trump presidency. And I was not a US citizen, and I became a US citizen during that time. So it was a very interesting time for me. And I think it was a pivotal point because at the time, there were all these like bans that were happening in travel, and I wasn't sure if I could leave the country or not. And I was preparing to go to Grenada for my public health internship, where I worked with the Grenada Planned Parenthood Association on a national survey around sexual and reproductive health. So it was just a lot happening, similar to, I guess, how people might be feeling now, where it's uncertainty about what you can and can't do. I was really frustrated because I was like, I can vote in that last election, but I sure have voted every election since, because I think voting is really important and having the opportunity to do that is important. After that, I graduated, didn't know what I would be doing after graduation. At that point, when I got to graduation, I did not want to do health education anymore. I was feeling a little bit burnt out by it. And I was like, okay, I have these 2 degrees. I have this unique skill set where I have the language of the public health space, but I also have the social work skills. So since I was more of a macro focused social worker, I had skills in like budgeting and fiscal management, grant writing, human resource management, evaluation. Like there are all these really tangible skills. That's something for me with graduate school that was really important. I wanted to focus on the skills versus the content. Like I feel like you can teach yourself content all the time, but you can't always teach yourself skills. So I wanted to make sure once I left my master's programs, I basically upskilled. I had all these skills that I could rely on. And that led me to this company called Altarum. They're a healthcare research and consulting nonprofit, and I worked in their Center for Behavioral Health as an analyst around opioids. I knew nothing about opioids. I had no interest in opioids. As I mentioned, a lot of what I've been talking to you about was like sexual and reproductive health, students' wellness. Like opioids was not really on my radar of conversation. Like we talked about marijuana or alcohol and other drugs, but never really opioids and the opioid epidemic in the country. So a lot of the job was learning the language around opioids. So like understanding the lock zone, understanding prevention, treatment, and recovery and what was being done in that space. And at the time, there's a lot of federal funds, federal dollars towards this work. So I got to work on a variety of projects. One was really impactful for me, which was with the Bureau of Justice Assistance. We had a training and technical assistance center where we were working on peer recovery support services. And this was one of the first times where I had a supervisor that was also a social worker. So I think that was really helpful and for me to see like how social work taps more into public health and how we like maneuver these spaces. And with that, we were working with organizations to help them. Like we had a national mentoring program and I was able to match like organizations that had established peer recovery support programs with organizations that were creating those programs, as well as we were working on like a national opioid prevention collaborative. So we went to like Albuquerque, New Mexico, Little Rock, Arkansas, Sioux Falls, South Dakota, places that I had never been to for these 2 or 3 day trainings to talk about opioid prevention, treatment, and recovery with the community as well as government stakeholders, and really assess or come up with ideas for what the communities could implement for these different issues. And
First of all, how are you?
oh, from there, I left after leaving Alterum. I went to my current role, which I'll talk about next, and what I do now. But the last thing on here was sort of the Beaumont Foundation. They have a 40 under 40 in public health. And in 2023, I was one of the 40 under 40 in public health honorees, which really, to me, steps all the way back to when I stepped into Michigan and through the Future Public Health Leaders Program, not really knowing what public health was. Now meandering to this journey of being recognized as one of the potential leaders in the field. And it was really a moment of realizing that the work we do has impact and we don't often see that impact for ourselves. Like I remember like filling out the nomination for 40 under 40 and I was like, there's no way I'm going to get this. Like looking at the people who'd gotten it before. But I'm always like, don't count yourself out because you never know. Like we always minimize the things that we're doing, but you don't know the impact or the level that other people are going to see the stuff that you've done. So on here, I also have some challenges. There are lots of major choices and crossroads that I think you all will also be facing. What I like to tell people is that your career path does not have to be linear. Oftentimes it's a little bit zigzaggy, meandering, a little bit circular sometimes in terms of where you might end up or what you might be doing. And I also say this, like, money is a factor. We all need money. Everything is really expensive right now. I just bought eggs this weekend. I was like, why was this like $7 for a dozen eggs? That's kind of crazy. But I do think for me, yes, salary is important because I have bills and student loans to pay. I also try to focus on, am I being fulfilled in the work that I'm doing? Is it really hard for me to get up to go to work that day? Like that's something that I value. Like I value my peace and happiness a little bit more as I've gotten older. I also think about funding education. Like, as I mentioned, I have student loans, but what I also try to do is find opportunities for scholarships or jobs. I'd worked throughout my undergrad and graduate degrees, to help sort of offset some of that cost. And of course, being overlooked as a younger person in a director role, oftentimes, especially as a Black woman in the spaces that I occupy, sometimes I'm the only one in the room. And sometimes people make assumptions based on my age about what I can and can't contribute. And I've had to figure out how to maneuver that and make sure that one, like I'm feeling valued in the space, but also that my voice is being heard because it matters and it's important. And that can be really hard to speak up or like decide what you want to say, how you want to navigate through it, what is important to you, what is not, right? And with that, I'll always say, like, find mentors or people in your corner who you can have these conversations with and say, like, hey, like, this is how I'm feeling. Like, how can I do this better? How can I walk through this? Because when I first started at Alterum, like, I had to advocate to get assigned to things that other people were just naturally being assigned to do. So oftentimes I'd be assigned to be the note taker in the meetings, and I'm like, I have these 2 master's degrees and all this debt. Like I can do a little bit more than take notes. Note taking is important, but I can do other things. And so what I had to do was volunteer to do things or like speak up and say, hey, like this is something I'd like to learn to do. So something I was able to volunteer to do was learn Articulate 360. So by the time I left the company, I was one of 3 people that knew this software, which is like an online software. You make trainings on it. And I was making these trainings. So we'd have the content and then we'd make this video in this software. I like learning things. So if there are things where I could learn a skill set, I was like, yeah, I can teach myself how to do this. So find those things that you want to tap into that are of interest of you and just like speak up about them is what I would say there. So what do I do now? So I mentioned at the beginning, I'm the Director of Strategic Initiatives in the Office of Public Health Practice. The Office of Public Health Practice, I liken it to like the field office in schools of social work. So, except it's slightly different because we don't oversee the students' internships or placements. But what we do is focus on experiential learning opportunities. So thinking of how you're going to take what you're learning in the classroom and applying it to the field. I also have adjunct lecturer appointments, both in the School of Social Work here and the School of Public Health. So I teach our public health in action courses where, if you're listening, I mentioned I'd gone to Grenada. As part of that, with those, we take students to Grenada, Texas, or Mississippi to work on projects with community partners. And in the School of Social Work, I just started adjuncting there last fall. So I taught one of the introduction classes around diversity, privilege, and oppression in social justice. And then I'm teaching a class right now on racial microaggressions. Outside of that, I think it's important to have identities outside of work or tap into skills that you aren't necessarily using all the time. So I also have a consultant on the side. I have my own LLC. And with that, I've really done like more so passion projects or things that excite me that I may not get to do in my day-to-day job. So remember, I mentioned I did a lot of health education. So I do a lot of workshops around like self-care and wellness and things like that, and have like custom worksheets that I sell on like Etsy or like use as part of these workshops. I also believe service is really important. So I currently sit on the board of health for Washtenaw County. And I'm able to provide a social work perspective. But what's wonderful about our county's board of county's health department specifically is that the health officer is a social worker. And I think that's really cool. And then, of course, I'm actively involved in my sorority. I'm a member of Alpha Kappa Alpha Sorority Incorporated. So I serve as the vice president of our foundation and run our scholarship committee. And I'm involved with the National Association of Social Workers Michigan chapter. I'm the first vice president of policy. And this sounds like a lot of things. There are a lot of things on my plate, but they all fuel me in different ways. So like, of course, I enjoy my job. It's fantastic in a lot of ways, but also, as I mentioned, there are things that I really enjoy doing that I may not necessarily get to do at my job. And oftentimes these things that I'm doing outside of my main role actually help feed or support my main role. So what does my day in the life look like? A lot of it is around stakeholder engagement. So really thinking of community and talking to people. We work with a lot of different community organizations on a variety of projects. And I'm sort of the voice of like putting all those pieces together. Like my direct supervisors always said, I'm good at like hearing all the things and kind of pulling out what we need to do or what are sort of the next steps from the conversation. And I really think that's because of my social work background, right? As social workers, we're great listeners. We're able to kind of tease out or listen into what's not being said in those conversations. Outside of that, it's people management. So I have 5 full-time staff that report to me, as well as we can have 6 to 8 student staff depending on the year. And so with that, I am doing a lot of managing different people, their needs, professional development, issues that may come up, policy engagement, all of these different factors, right? There's so much that can happen with managing people. And I think social work helps prepare you for that, especially if you have a background in case management. That will serve you well for managing people. I also do a lot of budgeting and grant management. So my role is 50-50. Like it's 50% funded through a grant from the Centers for Disease Control and Prevention, where I serve as the director for the Future Public Health Leaders Program. So that's the CDC funded undergraduate program. We bring about 30 to 40 students to campus for 10 weeks in the summer. And the students can come from all 50 states, Puerto Rico, Guam, or any of the other US territories. So with that, I'm also looking like right now, our application just closed Friday. So we have about 330 applications that we have to review to get down to that 30 cohort. So we'll be doing that over the next month or so. And then also at the same time, there are reporting requirements when it comes to a grant that I will have to do, or like plan the budget for the next year, account for the funds that we spent and things like that. And then the last bucket, which is my favorite bucket, I think, of them all, is teaching and mentorship. So students really excite me and engage me, especially in thinking of like, how are they getting into their social work careers or their public health careers? I really enjoy teaching my public health students about social work and my social work students about public health, and trying to get them to like take my public health students to take classes at the School of Social Work and my social work students to take classes at the School of Public Health. Because I do think we need to do more of that. Because our social work students, you're working on a lot of public health things, and our public health students are working on a lot of social work things. Like they are very much integrated, especially when you look at the grand challenges of social work, right? Closing the health gap is one of them. And a lot of all of the grand challenges are issues that we're tackling in the public health space. So I think we could do a better job crossing those lines. For me, they're very blurred, and I try to get people to think that way. I also get the opportunity to travel in my role and present at conferences. So this is a picture from, I think this was the Diversity Abroad conference, where I was talking about our public health and action partnerships with our community partners. There are lots of skills that I think I tap into, and I feel like I've talked about some of them so far, but I wanted to pull out some that I think we all should probably have and can utilize in lots of different ways. So one big thing is emotional intelligence and communication. I cannot do my job without good communication, because I'm communicating with lots of different people. We're talking students, we're talking alumni, we're talking faculty, staff, community partners. There's lots of different people that every day are interacting with us in some way. And also emotional intelligence, they're really important to understand, like, when are the right or appropriate times to have certain conversations. So for example, we work with our partners in Grenada. We were working on establishing a memorandum of understanding, and also starting a formal internship program, which was based on the evaluation that I did for my doctoral project. These were some of the outcomes that the community partners wanted. However, when we started the conversation this past July, the island was hit with a hurricane. So not the best time to be talking about MOUs and internships, right? Let's switch the conversation of like, are there ways we can provide support, right? Are there things that you need? How are you all doing? What is the support in that way? And I feel like that's where emotional intelligence is really important. Because a lot of times we kind of want to like go full steam ahead with our own agendas. But at the end of the day, we're dealing with people, right? We are people. The people that we're talking to are people. So we need to be able to pull that back a little bit and focus on people as they are, right? Not just the organizations they represent or like a line item in a budget, etc. I also like to think of the importance of program evaluation and continuous quality improvement. So program evaluation is sort of my bread and butter with the projects that we work on with our community partners, but also in the work that we do. So something that we're doing right now is we're doing a needs assessment to understand our undergraduate and online student populations, how we can better serve them. Because for the longest time, our office has just been focused on residential students' needs. So now we're doing this to better understand what are the needs, how we can do better. We also have done some evaluation with what we call our Practice Advisory Council, and that makes up representatives from the school as well as community partners. So really ensuring that their voices are better integrated within the school and we're better integrated with them. I mentioned, of course, budgeting and fiscal management and grant writing. They're great skills to have. I know everybody's not into finances, but you should be at some level interested in the finances related to your organization, because whether you are a coordinator or a director, you should kind of know where the money is, what's coming and how it's being spent. So something I'd encourage you to do is like, if you're working on a project or you have the opportunity, like express interest for your field of like, hey, I would be interested in exploring or helping out with this budget. Could I have a budget for this program, and like create a budget for it that you could look at? Because that's a skill that I can say you will likely use, especially if you end up in the nonprofit space. And of course, creative problem solving. I'm always putting out fires, especially with running a summer program. Um, there's lots of things that come up that may happen unexpectedly. So just thinking of ways that you can maneuver through the things or think through the challenges. I have a feeling based on a lot of the executive orders that are coming out, we might have to do some of this creative problem solving for a summer program this summer. And of course, flexibility and adaptability, like being open to change, especially when we're working in community. Like, for instance, I'm preparing students to go to Texas for spring break, and they're going to be working on a community health needs assessment. I had a scope of work that we agreed on with the community partners back in December. Like 2 weeks ago, that has changed. So instead of the students doing key informant interviews, they now want them to do a neighborhood scan or a windshield survey, right? So being able to pivot and also help other people pivot, I think is especially important within this. So those are some of the things that I do, like with my job in a variety of ways. And I think what I like about it is that no day is the same. It's hard to say like, oh, goes by every day. I mean, every day I have a ton of like meetings. Some of them that could have been emails, but there's lots of meetings and conversations. So navigating through that, I think, is often interesting. All right. So within public health, we have what's called the 10 essential services of public health. And it's this framework that really thinks through how we should be thinking and addressing public health. So it falls in these areas of assessment, policy development, assurance, and it's things like building a diverse and skilled workforce, assessing and monitoring the population, create champion and implement policies, plans, and laws. So these are the 10 things that they think that all public health services should be doing. I think this slide was really interesting for me to think about because there is so much happening in public health right now. If you turn on the news, it's just a lot happening. From people not being able to access data sets with the CDC or websites disappearing around like HIV or reproductive health. Like there's so much happening at this time. So I tried to pull some things so not to make it too exhaustive. Like we can talk about a lot of things here, but like artificial intelligence has really been a big conversation that I've been seeing within public health of thinking around like what are the ways that we can use or leverage AI and how can we do this equitably or appropriately without harming communities. I'm sure you all have heard of like ChatGPT and there are all these other GPTs, but they use a lot of water, a lot of environmental things, resources that I don't think people realize when they're using them. So I'd be curious, just look it up and see for yourself, but just thinking of like, okay, how can we leverage this as a part of it, but also how are we protecting the communities that we're working in? The other thing is climate change. We've seen a lot of climate issues that have been sort of exacerbated. So I mentioned in Grenada, for instance, they had a hurricane in July. Now, yes, the hurricane season is June to November, but it's very rare that you typically have a hurricane in July. Usually it starts like end of September, October. And hurricanes are also getting stronger. We also think of the California wildfires and how many of them were happening simultaneously, or the hurricane that hit North Carolina. Like we have all of these things that are happening that are further being exacerbated with time. Then we also, I like to think of mental health as something that's important that we're seeing like post-pandemic. I don't feel like we ever actually spent time to recover and process the pandemic and what happened to us collectively or the collective trauma that we have as a society. And so I feel like we're seeing this bubbling up a lot, especially within my summer program. We've partnered with an organization that provides wellness coaching to the students to help support them throughout the summer. And I think we will need a lot more of that. We need a lot more mental health professionals. We don't have enough. Our populations are also aging. So people are living longer, which is good. But at the same time, we need to have supports in place to meet people across the spectrum. And I mentioned some of these political changes. Politics impacts public health a lot. In lots of different ways. When you think of funding, you think of laws and policies, you think of access to services, particularly with the federal funding freeze that now has this injunction. That was something a lot of people in my public health circles were scrambling to think about. Well, how are we going to keep these programs growing and funded to help communities? Local health departments are often underfunded. The range of money that's spent at a health department per person really varies. I think there's an old statistic where it was like on average, like maybe like $40 per person was what was spent on like local public health, but it really varies depending on where you are geographically. So there's lots happening in the political landscape that I think will impact the opportunities that are available and the work that has to be done. But I also like to think of this as there's now opportunity for more social workers to get into the public health space and for us to like integrate better and work more closely together. And of course, reproductive health challenges. As someone like I am expecting my first child right now in like the next 2 months. So this is something that's top of mind for me, and that's why I end up there. But thinking of maternal health outcomes, access to birth services or care like doulas, community health workers, how that taps into the space. So I feel like these are some of the things that present opportunities for the future for all of you as you're thinking of like, what might I want to get into? Public health sounds interesting. How can I tap into this in certain ways? And I'm not saying, oh, you have to go get an MPH. There are lots of ways that you can do public health without having a master's of public health degree. So public health has a lot of interdisciplinary connections that I've sort of mentioned. So I've mentioned the different community partners that we've worked with over time. And to me, I kind of think of it in these 3 C's. So connection, collaboration, and community. We all are interconnected and we all can do better together, right? So we need to collaborate across different things. So the first picture on here is myself, a student, and one of our partners in Kentucky, where Kentucky had really bad flooding in, I'm blanking on the year. I think it was 2022 or 2023, that were historic floods. And we were able to go help support a CASPER, so Community Assessment for Public Health Emergency Response, across several counties in Kentucky. And I'm talking within the mountains and the hollers of Kentucky, that we were going out into the community. That could not have been done without all these people coming into the space and sharing resources. So that's an example of collaboration. Connection, I think, is key. The second photo is at the CDC showcase last year with our students from Guam. We were really excited because this was the first time we had that many. Usually we have like 1 student participating in the program, but we had 4. And it really shows the importance of like building out those networks. So we were able to utilize our past students to help spread the message about the program and then get more students excited to come and participate. And the last one is community. That's a picture of our students with the Red Cross volunteers in Grenada that were going out collecting data around. This project was specifically around starting a voluntary blood donation program, so understanding attitudes and perspectives around that. And I think it's really important to recognize that we don't exist on an island. We have greater impact when we join together. Like within all these different things, there are social workers that are involved and tapped in lots of different ways, right? So in thinking of like, what are the things that you do well that you can bring to the table and how can you tie in with that community? And of course, I like to remind people to do what brings you joy, and think about what legacy will you leave behind. Like when I was back at girls group, my social work supervisor would say, what is your legacy project? So when you leave this agency or leave this program or leave wherever that thing is, right? Because you're there for that specific period of time, what are you going to leave behind, right? What parts are going to be left there that are sort of tied to you? Not in the way that it's like, oh, I have ownership of this, but making sure that you give back to the communities that you're working to and give back of your time, your efforts, your energy, ideas, resources, and make sure that they stay and thrive and continue to exist beyond your time there. Oops. So I've talked a lot about me. Now I'm going to talk a little bit about career advice. Yep. Within here. As I mentioned, I like quotes. And this one, I think is really important because I like to think about what it might mean for me. So it says that the difference between great people and everyone else is that great people create their lives actively, while everyone else is created by their lives, passively waiting to see where life takes them next. The difference between the two is the difference between living fully and just existing. So I don't want you all to just exist. I want you to live really full lives. So if you're interested, and these tips can apply to any career, but I'm talking about public health specifically here. If you're interested in pursuing public health careers, there are lots of things out there. I definitely highly recommend seeking internships or volunteer experience. So there are tons of internships and opportunities out there. An example of something could be, depending on where you are your journeys is like CDC has something called PHAP, which is the Public Health Assistance or Associate's Program, and that places you at a local health department for 2 years. So that gets you your foot in the door within the health department to better understand public health, but also seek volunteer opportunities and experiences to learn a little bit more. Like when I started working at the University Health Services, I started out as a volunteer before that turned into a paid position. The next thing is to make mistakes, learn from them, and pivot. Especially when you're a student, you kind of have a little bit of a buffer when it comes to making mistakes. It's a little bit harder when you're out there in the real world, not as protected as you would be as a student, to make mistakes and pivot. But you have the opportunity to try things, figure things out for yourself. Like I did an internship after the Future Public Health Years program where I worked at the VA in West Virginia as a public affairs intern. Interesting experience, but I knew federal government was not for me. That's not where I wanted to work, right? So you learn more from the experiences where you don't like what you're doing than the experiences where you just love everything about them. And of course, it was like, that was time to pivot. It's like, okay, I'm not interested in this. Like, there are aspects about this that I was interested in, maybe not so much. What can I take from that and then pivot to something else? You also want to build your skills. I put in here within community assessment and mobilization because I think at the time we're at, that's something that we all need to be able to do. Like we need to be able to advocate. We need to be able to lobby. We need to be able to talk to our elected officials and get things done. We need to be able to build community, and think about how we can measure change or show like, hey, these things have impacts, whether good or bad, within the work that we're doing. You can also consider credentials or certificates. There are lots of different certificate programs out there. I list a couple on here. Like this, there's a certificate in public health, for instance. There's a community health worker certificate. There's a certified health and wellness coach. There's so many different things out there that you could consider if that's something that's of interest to you. And of course, prioritizing your understanding of the social determinants of health and health equity. So I defined those at the beginning, but the more you can speak to those and know about them, that would help you maneuver your career. I also highly recommend going to conferences and joining affinity groups. So like the American Public Health Association has a specific public health social work section. And that's a great way to tap into what are people doing in public health that are social workers? What are they out there doing? What's important? How you talk about this? How we can navigate that? And it's a great way to like network and build connections. Something that I did when I was getting my doctorate in social work and kind of deciding what I wanted to do was I looked at people who would have my exact degree combinations because I was like, okay, this needs to make sense. If I'm going to do this, yes, I want a doctorate for my own selfish reasons. Like I'd always wanted to be called Dr. Sade. That was something like personally that I wanted, but I wanted to make sure that the doctorate that I pursued makes sense for like my career path and journey and the opportunities that it may open, right? Because this was an investment in my time. And just reaching out to people on LinkedIn who had those and be like, hey, I am interested in pursuing this. Do you have time to like chat for like 30 minutes? Or like, can I send some questions to ask you about your day to day? Like, what do you do? And 9 times out of 10, people are willing to talk about themselves or interact with you, right? Sometimes it takes some follow up because everybody's checking their LinkedIn, but there's a great way for you to network and build those connections. And of course, use your continuing education. As social workers, we should always be continuing to educate ourselves in lots of different ways. If you're pursuing licensure, you will have to do continuing education. But even if you're not pursuing licensure, you should be doing continuing education to keep yourself up to date of all that's happening. Now, in terms of career paths, there's lots of different career pathways. There's tons of different job titles out there. Like I pulled a couple on here. Some of them I like looked in my LinkedIn for MSWs in public health and see the people that I knew, what were some of their job titles so I could share it with you. So like Director of Community Partnerships, a Health Equity Manager, Grant and Contract Coordinator, a Learning and Development Specialist. So there are people with these job titles that are out there that you can reach out to. Like Analyst was one that I had, for instance, that I talked about. And of course, there are a variety of different settings. So I primarily talked about working in academia and working in consulting. I mentioned working with the federal government, working with nonprofits. That's primarily been the spaces that I've worked in, but that doesn't mean that those are the only ones. So local and state health departments need social workers all the time. Like that's a great way to get your foot in the door within public health. There are jobs within foundations. One of my friends works with Annie Casey Foundation on juvenile justice work, right? There's also thinking of think tanks or associations, research and policy organizations. There's even a commission corps of the U.S. Public Health Service, if that's your thing, but they hire clinical social workers as a part of that as well. And of course, global or humanitarian organizations always need social workers. So these are areas that you can tap into within that. There is a link to this resource guide. I'm going to click on it and hopefully you see it when I do that. This is a guide that I put together specifically for my Future Public Health Leaders Program students. And they are, of course, undergraduates, so that's sort of the lens. However, there's a ton of resources in here that could be good to you. So there are some common job titles within public health, kind of by area that you can think of. Now, some of these areas within public health require a little bit more specialization and training, like epidemiology and biostats, for instance, but some of them don't, right? So I'm thinking of the skills or areas you might want to look into. There's also buzzwords or things you can think about. So when you're doing your job search, you might want to think of like, okay, maybe I don't know what the job title is that I want to do, but I know like I'm interested in working with families around like diabetes and designing programs in some way. So playing around with these different words or different skills that you'd like to use to kind of see what pops up in your job search. There's things on relocation finances, but really to the bottom, there's different kinds of organizations that you can look into. So different associations within here, different public health information databases that you can tap into, different pathway programs, fellowship opportunities. There's a ton of stuff on here. And if you keep this link, like I'm going to be updating it for 2025 soon. So say instead of 2024, 2025 on it, but you can have this and just save the link, bookmark it. I'm always going to try to keep this updated so long as I have the funding and the time to do so, but it's something that I'm passionate about. But there are things that you can tap into and take a look at and see if there are things that pique your interest. I also want to point out this other resource that you could get via email. I did not make this, but Annie Greer is a really awesome social worker that talks a lot about macro social work and how social work exists on a continuum. So a lot of times we talk about social work as micro, macro, but really social workers engaging in micro work are going to engage in macro practice, and social workers engaging in macro practice are going to engage in micro work. I always joke and say I never wanted to be a therapist as a social worker, but supervising people, oftentimes I feel like that's what I'm doing. And working with students, like having those one-on-one conversations, I'm tapping into those skills anyway. But she has these two resources that are around building the case for social work students, so how you get into macro practice. And there are these really good workbook like documents that you can kind of use to think through how you navigate your social work career and how you might want to look for your social work jobs. So with that, I'm going to stop there and see if there are any questions. And I'm going to stop sharing my screen so I can see if people have questions.
Awesome. Thank you so much. Thank you so much. Yes.